I want to talk a little bit about some of the current trends that we're seeing in healthcare. Historically, over the last several years, we've seen a fundamental shift take place in multiple trends, and it's worthwhile to discuss. So, historically, we saw a focus on things like illness, acute care, inpatient care, very individualized health, fragmented care, independent institutions working in silos essentially, and then also service duplication. However, over the years, we've seen a pretty big shift in a lot of areas. So, illness is now starting to see more focus around wellness. So, historically in the United States, we spend less than 10% of our healthcare dollar on well care or wellness initiatives. We are starting to see a shift, and it is starting to move, but it's still very leaning towards the illness initiative. Acute care, we're now seeing more focus on primary care. You find a doctor, you get established with that doctor, that physician knows your ins and outs, everything about you, and is kind of your lifelong partner in care, essentially. Inpatient, we're seeing more focus on outpatient care. There has been a ton of studies that come back and say patients recover better in the home. So you're seeing a huge surge in places like outpatient surgery centers where minor procedures can be done in a clinical setting, and then you can be sent home that day to recover. Also, being at home, you have obviously significantly less risk of hospital-acquired infections, and you're not stored with a bunch of other sick people. Individualized health, we're starting to see more initiatives on community health, community well-being. One thing that's gotten a lot of attention is things like flu vaccines, well care, exercise programs, that sort of stuff. Fragmented care becomes managed care. Okay, so connecting all the pieces together, your primary care is in step with your dietitian, is connected with your specialist. Individualized institutions are starting to become integrated systems. So good, bad, or indifferent, the smaller health systems, the small physician practices are getting bought up by larger healthcare systems and healthcare entities. There's good and bad to that, but as a patient, it can be advantageous to have everything under one collective roof. Service duplication, we're seeing a shift towards continuum of services. So you no longer need to have a chest x-ray done by your primary care, done by your cardiologist, etc. We do it once, we reduce cost, we reduce duplication, and also can increase satisfaction and make the system more efficient and effective.